Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurvich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. This podcast is for informational and educational purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your medical plan.
Hey everybody, welcome back to the Point of Medicine podcast. We are really excited to be interviewing Dr. Gillian Ehrlich today. She is a doctor of, well, she's got a lot of acronyms after her name, which we were like saying, oh my God, you're really smart. So she is a doctor of nurse practitioner, and she is basically a family nurse practitioner in the Seattle area. And I knew Gillian from like a million years ago to Ayurvedic school together. Recently at a conference, and I was like, oh my God, you do all these cool things. It's so great to see like how, we've kind of come to the other side and are like having our practices and what we're doing. So Gillian was trained in Ayurveda and functional, and she has an expertise in neuroimmunology.
Yeah.
And she is the founder of Ayurveda Health, which is in Seattle, which is her clinic where she runs. Sounds like a really amazing tight ship with really helping a lot of people. She earned her Doctor of Nurse Practitioner at the University of Washington, and then trained with the Institute of Functional Medicine and also the Ayurvedic Institute with Dr. Lad, with all of the Ganesha,
Yes.
Things that we had to learn, which was so much fun. And then she is also, basically, she's a contributing author on Ayurveda and neurology in the Andrew Wiles integrative textbook about functional medicine. I think that's amazing that you worked on that, which is pretty cool. And then she has done 25 years of, having her feet in the Ayurvedic world, 15 years in functional medicine, and her work really focuses on integrating the ancient wisdom of Ayurvedic medicine with Western medicine and functional medicine today. And you are really into regenerative agriculture, which is cool. I hope you have a farm up there somewhere. Wilderness leadership, which is super cool. My daughter wants to get into that, and care for vulnerable populations. And at Ayurveda Health, she offers advanced therapies and education in a grounded, systems-based, human-centered approach. And I'm so excited to talk to you today. I'm so glad I ran into you.
I know, that was so fun. Thank you so much for having me. I really appreciate it.
Yeah.
I love these conversations that are kind of like a little bit outside of my usual cast of characters, because that's where so much creativity can happen. So thank you so much for having me. It was really fun to run into you.
Yeah.
Yeah.
So I just gave kind of your intro. Can you tell us a little bit more about like your practice up in Seattle and like what you do?
Start there and get here.
I know.
Oh, that might be a long story, but
That's
let's see.
I know, I'm clearing my throat. I'm getting ready to launch. So what I'll say is that I grew up in Cleveland. I did not know what I wanted to do with my life. I looked around at a lot of the things I saw in Cleveland in the late 80s and was like, this looks interesting to me. And how am I going to live an adult life and make a living? And I ended up, a couple things happened. One is that I had an incredible teacher in high school whose name was Jane Esselstyn. She's the daughter of Caldwell Esselstyn, who wrote who was in Forks Over Knives, the movie Forks Over Knives. And so her whole family was vegan growing up, and her brother Rip does the Engine 9 diet. And Jane Esselstyn, starting when I was 16 in 10th grade, was our health teacher. And just the way that she was in the world, I was like, this is interesting. This is fascinating. And so and she worked for Outward Bound, which is a program that does outdoor leadership programs for young people, adolescents mostly, and adults. And so I ended up kind of getting into wilderness in high school, did a bunch of camping and climbing, and then ended up interested in, I like trees. So I came out to Evergreen State College in Olympia, Washington, sight unseen, landed here. And the only program they had available was ecological agriculture. Growing up in Ohio, I thought farming was pretty boring because I'm used to just, 10,000 acres of monocrop corn. But it was the closest thing I could get to trees. And when I went in my first day at Evergreen, and everybody was talking about organic food, and I thought, okay, organic just means it has a carbon molecule. So what is inorganic food? Like salt? Like, what are we talking about here? And I remember thinking, Gillian, just keep your mouth shut. All will be revealed. You will be able to figure this out. And eventually I did learn what organic food was. And it was an amazing year. It was an amazing year of growth. And that was back in 1993. We had Paul Stamets, who's very well known now, but we had him as a teacher talking about mushrooms, wearing his mushroom hat back in 93. And a bunch of the characters that are in Michael Pollan's book on how to change your mind about psychedelics. Michael Bugh was a teacher of mine also that year in that program. We had Pat Levine. I mean, just some pretty incredible folks. And so I learned a ton, and it really launched this interest in health and medicine and agriculture and working with people. And so from there, I was a wilderness instructor for about 6 or 7 years, mostly with adolescents. And then a childhood friend of mine, Anisha Derve, which I don't know if you know her, and do you know Anisha?
Anisha, was she in our class?
Yeah, she was in, you and I weren't so I think you and Anisha were the same year, and then I came the next year. So when you were in Gurukula with Dr. Ladd, I was in what they called ASP1, Ayurvedic Studies Program Level 1. So that was the first year I was there. And that was back in I joined the Ayurvedic Institute in 2001 was the year I was there, but Anisha had me showing up for classes as early as I think 98 or 99. And I started using what I was learning from Dr. Ladd about Ayurveda with my Outward Bound students. And I could not believe how much better they were, how much more efficient their learning was when I could look at their dosha and understand how they would learn. And I could understand how to shift my cadence, my speech, the amount of information I was giving, how I was giving the information for it to land correctly. And ultimately, it doesn't matter to me how I say things. If I'm teaching, I want students to understand. And so being able to know how they would understand information better was like, ding, I was thrilled with that. And so I went back and studied Ayurveda for the year. And when I left, I thought this has to be our common ground in medicine. And so that started, I was like, well, how am I going to do that? I didn't want to just work kind of in the shadows, or, this was back in the early aughts. And so I thought I have to go into conventional medicine because I really want to bring Ayurveda to conventional medicine. And so I went for nursing because it seemed like I didn't think I was going to manage med school. Med school looked like you weren't allowed to sleep. You weren't allowed to go outside. And those are pretty primary things in my world. And so I went for nursing. I was a nurse at our downtown inner city Seattle hospital off and on for about 8 years. And in that, which is Harborview Medical Center. And it was incredible learning, being able to watch people, live and die and get coded. We were part of the code team. So we would stand at the head of the bed and write down how all the codes went. And so it was just incredible learning about being with people and then in very vulnerable times. And then going back for nurse practitioner, I rekindled a friendship with Keisha Ewers. I don't know if you know her, but she's an Ayurvedic nurse practitioner also she has a PhD in sexology and sex. She says intimacy is where we do our deepest work, and which I think is very true. So she introduced me to functional medicine in about 2009. And so I started my functional medicine training in 2010, finished my master's in 2010, my master's of nursing, my doctorate of nursing practice in 2011, my certification in functional medicine in 2014. And I ended up working at Harborview's Medical Respite, which is a medical shelter for 32 adult men and women who have acute medical needs, but also no home to go home to, things you or I would go home with, non-weight bearing, braces. If you've got to get to chemotherapy at 7 a.m. in the morning every day for 3 weeks, it's really hard to do that if you're sleeping in a tent. And so people would come stay with us to get their care, wound care. And I love that work, but I couldn't do Ayurveda there or functional medicine. And so I ended up at Swedish, which is a big system here, buried in primary care for about 6.5 years, doing Ayurveda and functional medicine in primary care. And it just about killed me. And so I then moved over in 2019 to study and work with Dr. Eileen Ruhoy, who's an incredible integrative neurologist.
Yep.
And I mentored with her between 2019 is when I went over there full time, until about 2023. We worked together. And so her practice was then called Center for Healing Neurology. And during the pandemic, she was like, I want out. And she wanted to do more long COVID work. as we were seeing that burgeoning. And so I took over the clinic and then renamed it Ayurveda Health, just because I'm not a neurologist. And I really wanted to recognize the full embrace of Ayurveda functional medicine in this neuroimmunology piece. And what I'll say is that in the last 15 years that I've been in practice, as I look at how the research especially has changed, it's the interventions, yes, but it's also especially the approach and the research. And every year it gets closer and closer to Ayurvedic medicine. And that is I can say that on my life, I would say that the way that we are, and there are principles in Ayurveda that we now see in neuroimmunology, that we see in the literature, that we will see coming down the pike in terms of how we practice. And this stuff is elemental. So we are made of light. We are more space than we are structure. We are spirit first. We are built of a conglomerate of information. So food is information as well as structure. We think of ourselves like a car, right? You go to the doctor to get fixed like you would fix a car. And when you fix a car, you pull it into the garage, you turn the engine off, you take parts out, like even the battery, even the heartbeat of the car, you take out the brains of the car, you can take out, you can fiddle with them on the side, and then you can put them back in. But we are a living organism, and we are built of constant flow of information, and you can't turn us off. You can't just take out a brain you can do bypass in terms of heart, but you can't take out a brain, you can't take out parts. And so this is essentially, we are a jet engine that you have to fix in flight. And the conglomeration of information, we can now affect how the information rolls. And those are interventions like low-dose naltrexone. Those are interventions like ketamine. Those are interventions like immunosuppressants. All of those are shifting how information moves through the body, because lo and behold, as I was saying, that I want to emphasize, so I'll say it again, even though I already said it once, we are more information and space and light than we are structure. So all of that to say, that is one simple way in which we see Ayurveda in the modern world. And Ayurveda had approaches for perceiving this, for evaluating this, and for doing interventions for this 10,000 years ago, which means that they also are low tech. So as we look at how do we impact public health, how do this wacky world of red light and methylene blue and stem cells and peptides, how do we bring together that world and this world of public health, which I think are very much at odds based on the fundamental economies of difference. Those worlds really come together beautifully and seamlessly in Ayurvedic medicine, which is from India, the traditional medical system of India, and has been in existence for over 10,000 years.
Just because I've so rarely spoken to somebody who's trained in both Ayurveda and functional medicine, was there any overlap in those trainings, or were they completely different entities?
I mean, structurally, they are completely different entities. My big hot plan is to build educational modules that actually do recognize their overlaps, because their overlaps are so heavy, deep, and real. But Ayurvedic training, especially with Dr. Ladd, as Anne knows, is he has been traditionally trained. And when you talk to Dr. Ladd, you don't know if he is channeling something he was trained in the 60s, or if he is training, he'll say the speaker would like to share. And you don't know if that speaker is from 5,000 years ago. Like what he says in terms of training is a traditional Ayurvedic model. Functional medicine is the brainchild of a group of really incredible clinicians, spearheaded, but not solely, run by Jeff Bland, who has a PhD in nutrition and is an incredible systems thinker. He actually lives here also in Washington State, so I get to see him not infrequently, which is nice. But in the early 90s, like 90, 91, 89, 88 to 91, they kind of dreamed up this functional medicine platform as a way to recognize the systems biology nature of health and healing. And that was different than the reductionist, the parts. If we can just get smaller and smaller and smaller parts, then we'll learn it all. And lo and behold, every time we think we have the smallest part, we can break it apart and find littler parts inside. We can find quarks. And so there's neutrinos. And so there's more and more teeny, 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 tiny parts. And the idea is that, which is kind of where AI is going now, is that if you have enough information, you take those parts, it's a pointillism picture. If you put enough dots, suddenly the whole picture comes together. And so medicine since the 1600s in Europe, mainly Europe, and I think it's important to recognize, because colonialism says this is just how it is, and it ain't how it is. It's how it is. It's how it was in Europe. And so as the US developed, we took things from Europe. And so we think that breaking things down and being reductionist is the best way or the only way or the default way, but that's not how the majority of the world operates. So in Chinese medicine and in Ayurvedic medicine, everything is systems. In indigenous medicine, we can't separate ourselves. We are not separate from nature. We are part of nature. We are part of this world that we're looking at. And so at this point, functional medicine training does not include Ayurvedic medicine per se, although there can be Ayurvedic interventions that may be mentioned, but it doesn't include training in Ayurvedic medicine. It includes training in systems medicine, which can include approaches from Chinese medicine or Ayurvedic medicine, but it doesn't train on those systems of medicine. Does that answer your question?
I think so, yeah.
So they're very separate trainings. So if you want to be an Ayurvedic functional medicine practitioner, those are two parallel tracks that you would learn. And once you learn one, just like if you're a naturopath, you're going to learn, it's easier to understand a medical system that you are newly encountering because the systems thinking is similar. And it's the same way between Ayurveda and functional medicine, but they are not the same. And in fact, I would say that Ayurveda almost has just as much overlap with modern neuroimmunology and all of the mitochondrial medicine that we're now talking about. I have a podcast as well, the Ayurveda podcast for complex health. And I just recorded an episode with Hemal Patel, who's running the Me Screen, which is a new mitochondrial test based on the seahorse assay, which is used in conventional practices, conventional research labs. He has a conventional research lab. And so they've the Me Screen or the mitochondrial efficiency screen repackages it for a commercial audience. But looking at what those things are measuring, all of that has been and was and is described by Ayurvedic medicine. And let me just say one more thing. Sorry, you got me early, but got me on a roll. Ayurvedic medicine is also modern medicine. Ayurvedic medicine is, there's over 1 million practitioners in India. And so it's important to recognize that Ayurveda is not a historical medicine that has gone away. It is very much a living medicine. And it's now termed Ayush by the Indian government. So Ayush is Ayurveda, Yoga, Unani, what's next? Siddha, and homeopathy. So what's so interesting about being in India is that there's no one right way. In the US, we've got like a right way to do things and a wrong way to do things. There's very much like a division. And in India, there's so much Buddhic influence. There's so much Ayurvedic, and Hinduism is a religion of 10,000 gods and goddesses, and it is monotheistic. It's like the 10,000 faces of the gods and goddesses are just different representations. So it's, what is the color of the paint in this light? What is the color of the paint when it's night? What is the color of the paint when there's a red light shining on it? It's like there's only one wall with one amount of paint on it, but everything changes based on the perspective. And we as individuals are pillars of light that essentially shine on whatever we pay attention to. And that gives us the richness and the beauty and the mystery of life, and sometimes the tragedy as well. So we are here to experience, to learn, to grow as spirits, and we take this physical form to do that practice. But so Ayurveda is very much a living science, a living practice. There are 12,000 clinics that the Indian government has started all across India just in the last few years to highlight Ayurvedic medicine. And the reason we don't know more about it is because of colonialism, because the British intentionally shut down and pulled all the funding for government Ayurvedic schools in the 1830s and did everything they possibly could to diminish the respect and honor of traditional cultural Indian philosophies, sciences, arts in order to colonize. So it's really important to know that.
Wow. Okay. Apparently you had your chai this morning.
I know, I do have. I know, I might have more. So does that answer your question? No. Okay.
Yeah, no, first of all, I love the pointillism reference. That's so, I did a lot of humanities and art history in my early career, and that totally makes so much sense. I love it. So thank you for sharing that.
I use that pointillism. My first probably 5 years in practice, it felt like the pointillism, I could not, every patient I saw helped me understand everything. And I felt like I was drinking from a fire hose. And I felt like I was putting as many points as I could on this kind of like image of what is it to be a human being and how do we practice medicine in this day and age? How do we meet this moment? And so it took a long time before I felt like, okay, this is, I think about that Pointillism beach scene, that very famous Pointillism, like
Yeah.
Elizabethan or, whatever it is, picnic beach
They're all
scene.
hanging. Yeah. Picnic on the beach. Yeah.
Yeah. And I always, I realized, would start to recognize this is a lady's handbag, like it just takes a lot of time to learn this. It took me a long time to learn this, but I've now been doing it long enough that even though the picture continues to get clearer and clearer and crisper, and that is what I love about doing this work, I feel like I have enough that anything that anybody brings into me that says, this is my problem, I can go back either to the neuroimmunology, to the functional medicine, or from the Ayurvedic perspective. From Ayurveda, you just look at qualities, which are called gunas. There's 20 qualities. They are 10 pairs of opposites. And you just look at whatever a person is bringing in terms of their symptoms, and it will fall somewhere in the midst of these 20 qualities, these 20 gunas. And then at some level, you have some insight about where to start. And there are definitely patients that I've seen over the years. I think about one in particular I saw early on at Swedish who had, God, what was her triggering event? She couldn't stop losing weight. She couldn't figure out, she was losing weight. She didn't feel well. And now there's a lot of other things that I might consider. But at the time, I didn't have a lot of tools in my toolkit other than Ayurveda and conventional medicine. I was just in the process of learning functional medicine. And, so this was back in like 2011, probably 2011, 2012. And so I just went back to Ayurvedic diet. I just said, okay, if you can't digest very well, you need to eat very simple foods. And so we went back to things like khichdi and soups and broths. And if you cook a broth too much, like bone broth cooked for 3 days is going to release a lot of histamine. But so, you just need, like, my Jewish mother taught me how to make chicken soup as like you cook it for 2 to 3 hours, but you don't cook it a lot more than that. And so, just going back to these very simple, easily digestible foods, we talked a lot about spices that would help kindle digestive fires so that she could actually absorb, she could break down the food, transfer it across her gut lining. We talked a lot about gut lining healing. Even split mung dal has some evidence now. We use that in a recipe called khichdi or khichdi. And so khichdi is split mung dal with spices and sometimes sweet potato or beet, or, you can add various vegetables and ginger. So things that help support digestion, because in Ayurveda, we are not what we eat, we are what we digest. So when the focus in nutrition hangs so heavily on the foods that we eat, we miss where were they grown? Were they harvested lovingly? How long did they, how much prana, how much energy, how much life force did they lose en route between Chile and here versus like Olympia in Seattle or, down the street, but also like, how are we digesting it? And so you really need to eat for the level of digestion that you have. And so that was a patient that I saw, and that is really all we did. And she was able to stop the weight loss. And the last time I saw her was probably 2013. And she came in to say, I just wanted to come say thanks. My husband says you saved my life. And I said, I don't even know what we're doing. I don't even know what we're treating. And she said, well, whatever you did, it was really helpful and I'm really grateful. So, sometimes we may not have a name for something, but by using the Ayurvedic paradigm, we can look at what the qualities of the condition and the problem are, and we can use the qualities around us in the world to either counteract that, to support that, to find that balance. And so I think it's a really useful tool. And it's not, you don't need to do whole exome sequencing in order to understand this. Sometimes that's helpful. Mm-hmm. And I have definitely, I've had patients with Yao syndrome and patients with, Gilbert and patients with Lambert-Eaton. And so sometimes looking at either antibodies, or I do look at antibodies and I do look at genetics, and there is genetic testing, functional genetic testing I will do for SNP, for information about SNPs. But I think we're going to know a lot more about that in the next number of years. And I think at this point, still using the Ayurveda is my common go-to.
Hey, can we, first of all, I'm going to hop off for 1 second because my cat is going to like explode through the door at any moment. So I'm just going to open the door. But I would love to shift gears at this point because you studied with a pretty amazing woman, Dr. Ruhoy, and where we ran into one another was at the Mast Cell conference that we held out here in Hood River.
Yes.
I'm just curious, like, is that the majority of the patients that you feel like you're seeing? What is that? Like, how do you feel about like what mast cell is and like, why are we seeing so much more of it now? I'm just curious. I'll be right back.
Okay. I'll answer that question in absentia. I think that, so when the way I explain it to patients is that our mast cells, M-A-S-T, mast cells, is your cat okay?
Yes, they just get jealous. They're like dogs. Come on, you can come in.
Aww. So mast cells, M-A-S-T, mast cells live along, or not live, but they exist along surfaces. And they are our primary, they are part of the innate immune system. And our innate immune system, there's two legs in the immune system, the innate and the adaptive. The innate is along borders, and there's many of them, and they're not necessarily the intelligence officers, but they do their best to protect our borders. And our borders are really our skin, our GI tract, our respiratory tract, our genitourinary tract. Am I missing anything? No, those are the barriers. Those are our borders. And the way that I think about mast cell activation is we live in kind of a crazy world. We do not live in we don't live necessarily in a particularly safe world with all of the chemicals that were developed in World War II as bioweapons. They were transitioned into pesticides and herbicides in the 1940s so that they were given purpose and we could make money off of them and grow those big, acres and acres of monocrops that I grew up around in Ohio. And so even Dr. Pizzorno, Joe Pizzorno, is an incredible naturopath who helped start Bastyr, who does a lot of work on toxicity. He will say that the coal fires in China have a lot of mercury ash that comes across the North Pacific and ends up in Puget Sound. So even here in Washington State, where we have, pretty beautiful territory and a lot of trees and to be the lungs of our planet, to clean the air around here, we have a higher mercury content in the air. So if you are a person who is alive, which means you're breathing and you're eating anything or drinking water, then we are intaking chemicals into our system, let alone the light pollution, let alone the noise pollution, let alone all the plastics and the neuroendocrine disruptors. And so our borders are pretty overwhelmed. And the way that I describe mast cells is like if you're standing on a street corner and you're holding a small child's hand and a crazy Ferrari comes zooming by, it's natural to say, careful, and put a little pressure on that child's hand so that they step back from the road. Even if you're really not going to get hit, that's kind of a natural inclination. Like, let's just be a little bit more. And the way I describe it is that these mast cells are like, they are holding the hand of the child. They want to protect the being. They see the Ferrari and they go, get back. And they throw the child like 20 feet. So it is the correct perception. It's the correct intention. And it's an exaggerated execution. And so these mast cells are really kind of going crazy in our bodies at all levels. And because of that, we have an immune system that really is kind of a little bit out of whack to begin with. And then you have other triggers like an infectious disease. And maybe that's Epstein-Barr or mono. Maybe that's COVID. Maybe that is a strep infection. Or maybe this is something like mold, because now we've Tyvek'd our houses in the 80s. And so now every exhalation you take inside a house can't actually breathe. And so all this moisture from all this blah, blah, blahing I've been doing is kind of floating all around this room and can't escape. And so there's just more moisture. So there's more mold in our houses. Or maybe it's something like, a particular, we think of toxic exposure as being something like Chernobyl, or at least I did in the 80s. I remember watching it on TV and it was crazy and scary. But there's all these there's constant toxic exposures as well. And so we've got this toxin, we've got this mold, we've got these infectious conditions. And so here we have a system that's already trying its damnedest to protect us. And now we further overload it. And that is why I think we have so much more mast cell activation at this point.
Okay.
Great answer.
The next thing I really wanted to talk to you about that we connected with a little bit about at the conference is how you're using ketamine, and especially how you're using ketamine with these more complex patients, as well as the rest of your patient population. Can you tell me a little bit about what is your, I was an herbalist, so I am like, this is what we do. We have a relationship with the plants or the medicines, and we have a relationship with people and we put them together. What is your relationship with ketamine and how are you using it in your patient population?
So to tie in the mast cell, one thing I'll say is that in my experience, when I first started using ketamine with mast cell patients, I was very much like, oh God, how's this going to go? Mast cell patients can react to anything. I mean, I have patients who have me write them letters for airplanes for the particular type of bottled water that they can bring with them. And so I was like, if I'm doing that and they're having a reaction and they're literally on a psychedelic substance, that could be so bad. But I have gained a lot of confidence over the last number of years because mast cell patients tolerate ketamine really well. And I think it's primarily because the way that the ketamine works is that it is somewhat of a disassociative. So for these mast cells that are so attuned to the Ferrari speeding down the street and protecting the small child whose hand it's holding, being you as a person, the ketamine just lets all that neuroimmune system kind of chill out. And the second piece that the ketamine does is it actually does release brain-derived neurotrophic factor. So there is a cumulative effect of actually helping with synaptogenesis. So not neurogenesis. We're not growing new neurons, but we are helping the neurons that are there to connect in new ways. So essentially like a type of collateral circulation for the neurons. Not circulation as in blood vessels, but yeah.
It's a little bit interesting that you say that because I think of ketamine in particular about like the urinary system irritation. It makes interstitial cystitis worse. And I think interstitial cystitis, there is, I believe, a mast cell link. And so I guess I'm surprised that you're seeing the opposite. You're seeing that these hypersensitive, hyperinflamed patients are tolerating ketamine well.
Yes. And you are exactly right. That's specific to the urinary system. I am careful with interstitial cystitis patients. And there are folks who try ketamine and say, I was irritated. I can't do that. But as compared to the level of anaphylaxis that I see with patients trying substances or having throat closing or hives, I don't see that with ketamine. So, and I don't know that I can globally explain it.
You're administering orally, subcutaneously, IM, IV. How are you using ketamine?
It's a great question. We use all of the forms. And so to back up and just talk about ketamine for a second, ketamine was designed in a lab. It is not a plant medicine. It was approved by the FDA in 1970 as an anesthetic. And over the last decade or more, it's had an added indication for treatment-resistant depression. They've been using it IV as an anesthetic all of these years continually. And what we have found is that at lower doses, it can help for pain. It can help with disassociation. They're using it a lot more in the emergency room, even for things like fecal decompactions, which I know is like a really gross thing to think about. Somebody is too constipated, they're totally impacted and blocked, and you have to manually remove all that extra hard, dry charcoal briquette stool. It's like ketamine can be helpful for that because it just separates you from the pain and the horror of what is happening right now. And so ketamine can be used in that way. And I use it like that with patients who are having mental health issues, as well as patients who are having physical pain. And to answer your earlier question, Anne, I would say that who we see the most of is kind of what we call a pentad patient. So folks who have EDS or Ehlers-Danlos syndrome or connective tissue disorders, joint laxity, a lot of chronic pain, people whose shoulders fall out of place in their sleep. We see mast cell patients, so allergic to the world, can tolerate 5 foods, don't know how to live because you can't go out. Everything is unpredictable. And then dysautonomia. So we do autonomic testing here in our clinic. We're one of 4 labs in Washington State that actually have, or 3 or 4 that actually have autonomic testing. And so we do that to get the diagnosis and to look at the particular flavor. Is this POTS, postural orthostatic tachycardia syndrome? Is this hyperadrenergic dysautonomia? Do you have an abnormal QSART, which is the quantitative pseudomotor axonal reflex test, which is a sweat test that can look for small fiber neuropathy in the distal limbs? So, we can get kind of the flavor of it, but I would say that those 3 things, and then this autoimmune, chronic infection, long COVID, EBV, Lyme, mold, that's kind of our neuroimmunology patient that we see a lot of. And so ketamine can be used for so many different things. And so we use it a lot of different ways. We will prescribe it. You can have it compounded topically for a particular pain. If you can't sleep because you always get a crick in your neck, if we can put ketamine there and it can actually ease it in the night and then you can sleep, maybe that's all you need. We do ketamine as an IV, and we do IV in lower doses like 0.4 or 0.5 milligrams per kilogram of weight, which is kind of the standard protocol for treatment-resistant depression, or we'll use that for pain. We can use higher doses as well for the psycholytic, where you're just a touch, like 1 foot into that psychedelic world, or as a full psychedelic. It's not technically a psychedelic. It is a dissociative, but that's kind of what it feels like when you're in there. We also do intramuscular. And so when we do our dives, what we call our ketamine-assisted psychotherapy programs here in clinic, we often start with an intramuscular dive, although we can start with an IV. And then we also do home prescriptions for nasal spray, compounded nasal spray, or compounded lozenges for people who have a lot of chronic pain. And I use it a lot with mast cell patients so that they're just less reactive to the world. I have moms who need to take care of toddlers, who can't be in bed, who can't like remove themselves from a situation. They have to figure out, or people, I mean, and that's part of capitalism, right? We don't live in kind of tied in enough communities that we can all get what we need. And so sometimes I'll just be very open. I am prescribing this so that you can keep working, so that you can stay in your house and we can keep working on your health. So ketamine can be used in all those different ways. So oral, compounded lozenge, compounded nasal spray, compounded topical, intramuscular, or IV.
Very cool. I definitely see that as well. And all my mast cell patients that go into surgery, I always have to talk to them about, you need to talk to the anesthesiologist. You need to talk to your doctor about a good pain plan, because they don't tend to respond well to a lot of the typical pain medications like the opiates and things like that. They do respond better to benzos, but oftentimes I'm doing like ketamine in troches, which is like a sublingual way of taking it, just so that they can have something like on their game plan, especially if their surgeons are like, I don't know what you're talking about, But yeah, it's interesting. I'm glad that you have that same experience.
So, and you're seeing exactly the same thing. You're seeing that mast cell and hyperstimulatory patients respond relatively well to this treatment. It has some mast cell stabilization properties, maybe?
My guess would be probably, but I'm not really sure. I don't know. Gillian, do you know anything about that?
It's a great question. I don't totally know. It is an NMDA receptor antagonist, so it is counteracting some of that glutamate, which is that hyperstimulatory sort of neurotransmitter. And so I don't know exactly what the relationship is between ketamine and mast cells. I think that there is some research out there, but I don't have it at the tip of my brain. But I agree with you, and I see the same thing. I had patients going into surgery twice this week, and we had a lot of conversation about pain management, and I will prescribe them either typically nasal spray if they're not a typical ketamine user. Like if they're not already familiar with the drug, I'll prescribe the nasal spray, say take at least one spray before you go into surgery, not like the morning of surgery, but like, at least 24 to 48 hours ahead of time, just one nasal spray to get a sense of how you react to it. And then you'll know after your surgery, how much pain are you in and how much might you need and how would you use that drug. I did want to mention there is Spravato, which is the FDA approved treatment resistant depression nasal spray. There is certain training and like policy around if you are a site that provides Spravato, and we are not a site that provides Spravato. So that commercial product is not something that I use.
Okay. From what I understand, it's quite expensive too. So not really.
And from what I understand, it doesn't have as good of efficacy as we're hearing anecdotally from the IV or IM.
Yeah, I don't have a lot of patients who use it. So I don't know. I mean, I've had a couple. And so it's not been enough to give me a sense of, is it the Spravato or is it the patient or is it the diagnosis that we're using it for? Is it the condition? So I don't have a great sense of that. The compounded ketamine is, so the Spravato is just the enantiomer. We've got 2 enantiomers for every molecule. The Spravato is just one of them. The compounded includes both of the enantiomers. And so I don't know if that is what makes the difference or not. Often with drugs like levalbuterol, using the single enantiomer is actually better for the body. So I don't know. I don't know the answer to that part.
Yeah, I think I remember hearing that's what most people think it's because it's only the one isomer, that it's potentially not quite as effective. Yeah. Do you do any other like regenerative injections or anything like that in your practice?
So I don't, but we do. We have a whole team here. We have a 5,600 square foot clinic here in Seattle on Lake Union and Westlake. So on the west side of Lake Union. So I just have to show you because it's so pretty. This is my view.
Beautiful.
I want that view.
I know.
I get the cars like with the rap going like really loud across my front of my window.
That's kind of fun in other ways. But so our whole clinic is kind of along the east. We have these east facing windows, which is really beautiful. And so we have 3 nurses, we have 3 front desk staff, director of operations. We've got about 8 clinicians here who are either part or full time. And all of us offer kind of different things. So my specialty are these PENTAD patients in this neuroimmunology focus and the Ayurveda. We've got Dr. Juliana Giles, who's a naturopath that does integrative oncology and a lot of our entheogen work. So she does a lot of our ketamine work. And she's familiar with how the other psychedelics kind of combine with everything, which is really helpful. So she does a lot of cannabis work, but also ibogaine and psilocybin and ayahuasca. Those are things she is trained in. She
Great.
doesn't do them here because they're not legal, but just to say that she has an understanding. So when patients bring those questions, she can speak to that. And then the integrative oncology is really helpful. And then Dr. Carly Squires is also a naturopath, and she runs our regenerative medicine program. So we do offer here prolotherapy, PRP, prolozone. So we do have IV ozone, which people can do into joints or into IV. We've got stem cells that we can harvest here on site. We've got equipment for pulling out autologous adipose stem cells, and then we can spin them down in clinic, and she can inject stem cells locally into joints, or we can do IV for things like we've had an ALS patient, we've had MS patients, we've had other neurodegenerative conditions. So folks can get stem cells. We do exosomes, and we also do autologous exosomes. So we can draw blood, send it off for exosome harvesting and then an amplification. And then patients come back in about 3 weeks later and can get their own autologous exosomes. And we do plasmapheresis. So, and I would say our plasmapheresis, I think that we are one of the only clinics in the world that actually can join like the Ayurveda and the plasmapheresis. So if folks want to come for a panchakarma, which is the big traditional detox and reset program, they can tack on some plasmapheresis so that once everything is essentially mobilized and brought into circulation, you can do essentially what Ayurveda would call rakta moksha, rakta meaning blood, moksha meaning liberation. It used to be done in a variety of ways, including bloodletting or leeches, and now we just use the plasmapheresis. So we actually do the blood cleansing with the machine, so you get to keep all your red cells. But we pull out the immunoglobulins for autoimmune conditions. Plasmapheresis has been used also, like ketamine, since the early 70s for deep autoimmune diseases like myasthenia gravis, ITP, Guillain-Barré. And so we use it, we're finding benefit for long COVID. And then, of course, there's longevity aspects to it too. And we can send the effluent, the plasma that we pull out to Europe for testing. And they've been able to pull out plastics and
Wow.
and heavy metals. And so we know that that stuff is indeed coming out. We don't know what the total body burden is. So we can't say, is this like 0.01% or 80%? We don't have that. We can't do that. We don't have that technology to do that yet. But we are seeing definitely stuff come out. So in terms of other injections, those are, I think, the PRP, the prolozone, the PRP, the stem cells. Those are the injections that we have here.
Cool. Great. Okay. And then can you tell us about where people can find you?
Yeah.
Besides like just going to find some cool yachts and like maybe your clinic is right there.
Come sailing. So Neuroveda Health, NEUROVEDA health.com is our website. You can sign up to be part of the newsletter. So once we do start putting the educational pieces together, you can learn more about that. You are welcome to come in. We also have a big IV lounge. We do IVIG sometimes here for folks, although we try to get that covered. And we have mast cell IVs, and we have EDS IVs, and we have mitochondrial IVs, and
Wow.
immunotherapy support IVs, and glow ups, and NAD. We do higher dose NAD for addiction support and recovery and withdrawal recovery and support. And we also do methylene blue IVs here. So we've got kind of a lot of options. And we can do the PK protocol, the paticacane protocol with the phosphatidylcholine and sodium butyrate. So we've got a lot of options here in terms of injections, and then an IV therapy. And then we also do the Ayurveda. So even if you wanted to come in and just start with an Ayurvedic massage, which is typically a lot of oil, we also have a nervous system reset, which we kind of put together for very sensitive patients who are terrified of massage because of reactions that they'll have when you move stuff around. And so this is a lot of marma work, which is Ayurvedic acupressure with special oils or even ghee or even Lumna formulated Sweet Relief, which is a topical pain cream that we use a lot with neuropathies, or something called Calm and Uplifted, another Lumna product. So we can incorporate that into the massage. And then we have steam for detox, and we have Shirodhara and Abhyanga and Hindaswedana for frozen shoulder and joint pain. So all of the Ayurvedic therapies, including the Panchakarma.
Do you do Netrabasti?
We do.
That's like been one of my favorite treatments ever. And I don't know of anybody in Portland who's really.
What is it? I don't know what it is. What is it?
Oh my God, it's amazing. So you create like a dough, it's like an eye treatment, and it's like a ghee, usually like ghee and sesame oil or ghee and sometimes castor oil bath that you heat up the oil, and you create like a little barrier, and then you put it on the eyes, and then you either have like you make the patient kind of look up and like kind of all around. And oftentimes people will do some massage around there too, just to get the lymphatics going. But I think our eyes are so toxic these days because all we're doing is looking at computers and I remember getting those done and just feeling like my eyesight was so amazingly clear afterwards for like months. Like I was like, so I always want to refer patients to do that.
Oh, yeah.
But
So we do
I'm
Metrovasti.
going to have to obviously refer them to go up to Seattle to do it.
Yes. Yes. So, and we use the flour that we use is not wheat flour. Sometimes that's a question. So we use
Mhm.
dal flour,
Yeah.
and you essentially make like a moat.
Yeah.
And then you have the person close their eye and you spoon in warm ghee, and then they open their eye underneath the ghee. And the idea is that the eyes are really the window to the nervous system. And so if we can soothe the eyes, we can soothe a lot of the nervous system. And so much of our modern life, just as you're saying, Anne, is on screens and is eye focused. And so either castor or the ghee will really, the day of, your vision is you feel like your eyes are relaxed.
Yeah.
And your vision can be a little bit blurry initially. When you look up through the ghee, it's very blurry. You can see like if somebody leans over, but you can't make out their features, so to speak. But when you're the practitioner looking down into the ghee, the eye is very clear.
Yeah.
So it's very interesting how that shifts that perception. And your eyes will be a little bit cloudy initially for a couple of hours afterwards, but you wake up the next morning feeling so fresh.
Mm-hmm. Yeah.
I feel like I want it now. How have I lived my life without this?
It's
I
really
don't know
it's
how
an
you've lived your
amazing
life without
treatment.
it.
Well, thank you so much for all of your insight. This is a conversation like none of anything that we've ever had. And really, there's so many of these themes that I've just never heard about before. So I'm excited to share that with our audience. Thank you so much. We really appreciate the work that you're doing and just coming on and sharing it with us.
Thank you so much for having me. I'm so honored, and it's such a pleasure. And thank you so much for having me. You guys have a great podcast. So I'm happy to be here. Thank you.
Thank you.
Take care.